These concerns were raised today at the last day of the Midwifery Symposium by course coordinators of the 5 institutions who provide these trainings.
Some of the schools might close down.
PAU, if we have less than 10, the program will have to close. So currently we have only 13.
Last year we had 30 that was sponsored, which was good. This year we only have 11 that's sponsored by DFED. We also have another 5, but they are self-sponsored.
Standardized training for midwives in the country started in 2010. The Australian government, through DFED, has been providing scholarship to nurses to train as midwives. Through this scholarship, over 400 midwives have been trained, bringing the number of qualified midwives in the country to over 700. The Australian scholarship has been the backbone of enrollment for this course in all 5 institutions. Now that scholarship is phasing out, and the coordinators are worried that the government is not picking up.
What its schools are doing now is they're trying to go to the districts and talk to the districts. And for us, we know that there is this DSIP funding that comes to all districts, provinces, and there is 10 million that has gone. And we know that 2 million is particularly for health. We are trying to ask if each district could sponsor nurses who would want to come for study to take up midwifery. So with this 2 million, which is for health, if they can sponsor 2 students each, that will really help.
Resources are there to teach, facilities there, educators are willing and dedicated. What we need is people to teach, and we need students in the classrooms.
The government recognizes that maternal and neonatal mortality rates in the country have reached emergency proportions. Immediate and long-term measures need to be put in place to start saving the lives of women and children. One of those strategies is to place qualified midwives in all community health centers throughout the country by 2030.
I would like to ask the health minister, where will he get those midwives to place them in those community health posts to work as midwives? Because in the moment, at this time, I as an education provider, I am not seeing the government support to train these midwives.
Objective 3.1 says to reduce maternal mortality to less than 70 per 100,000 by 2030. That we may not achieve if we don't train more midwives for our country.
And the bottom line is the government should pay a lot of attention. Most of the time you hear maternal mortality, maternal mortality. Let's stop paying lip service, please. Let's get down to business and put our money where our mouth is.
Sarah Aupong, National EMTV News.